physics. Okay. So I think we can start.
Sir,
Yeah?
we can start. Yes, sir.
Yeah.
Yes, just time. Yeah.
Yes, just time. Gunjan Sharma, please start.
Yeah. So good evening, everyone, and namaste from India. So welcome to our fourth e-learning program of SCM-PCR ELP-4. And thank you for joining us for today's webinar. I am Gunjan Sharma, working as a medical physicist in Government Medical College, Amritsar, Punjab. I have completed my studies from Guru Gobind Singh Indraprasth University, Delhi, and I am moderator for today's lecture. I welcome you all to the first lecture of the fourth e-learning program. This is to inform you that there will be an examination at the end of 8 lectures, which will be of 1 hour each, and a group discussion. This is a program which has been accredited by EBA-MP as CPD event for medical physicists at EQF level 7 and awarded 32 CPD credit points and only 24 CPD credit points for those who don't sit for examination. We are pleased to inform you that over 200 candidates registered for this e-learning program, and the selection committee has chosen over 85 participants from 27 different countries. It is the project by LO1 Trust.
Yeah.
201 with an aim to create a skilled manpower in field of medical physics, especially in the South Asian region. Since then, it is organizing meetings, seminars, workshops, and hands-on training and an e-learning program. SCM-PCR has already implemented 3 successful e-learning programs with accreditation from EBA-MP, that is European Board of Accreditation of Medical Physics, and IUMP. The unique design of SCM-PCR training and e-learning program already have made a very popular platform for teaching, learning, and sharing knowledge between medical physicists of different origins. Its motto is quality education for understanding the concept for the patient benefit. This vision of imparting quality education to budding physicists all across the globe, specifically in South Asian region, belongs to Chairman Professor Dr. Ghulam Abu Zakaria. He has been the cornerstone of SCM-PCR, and its all program are the product of his efforts and the team that he has built. He is the former chairman, chief medical physicist of the Department of Medical Radiation Physics, Gamarganj Hospital in the University of Cologne. He is currently professor at and working at the University of Applied Science, Cologne, Germany. He has 35 years experience, 100 research papers he has published, and supervises various theses. And now I would like to request Professor Dr. Ghulam Abu Zakaria, Chairman, sir, to deliver a few words as a welcome speech to all the participants.
Thank you so much, Mrs. Gunjan Sharma, for this nice introduction. I want to only say good morning to everybody, maybe good day somewhere, and good evening also somewhere in South Asian regions. Yes. Actually, this is a very interesting topic, you know, radio diagnostic, yeah. Especially the topic is quality control in medical imaging. This is a very important topic for the physicist working in medicine. Earlier time, we know when you say medical physicist, everybody know radiotherapy physicist, but the thing is changing. Now, I have seen many countries, even in developing countries, the medical physicists work in radio diagnostic. This is actually in Europe, it is actually mandatory to appoint a physicist in the diagnostic department from 1st of January 2019. Professor Franco Milano is a very good expert. He's a well-known person all over the world. He will explain you more about that. I'm very happy that you actually joined this course. Some of you maybe joined our earlier course, you have enjoyed. And we have a very quality course here. We try to establish a quality course with a very good expert and of course accredited course. So I think you will enjoy. Please stay with us. And we have at the end, there is examination and you can judge your knowledge what you have learned in our course. I hope you have learned a lot. that help your hospital. Last but not least, I just congratulate and thanks my group headed by Mohammad Ullah Shemanto, and of course the Professor Franco Milanco to join us, and of course the nice monitor Yanjan Sharma. Thank you once again and enjoy your course. Thank you.
Yeah, thank you so much, sir, for your inspiring words. So today's lecture is on the topic, Introduction of Diagnostic Radiology and the Role of Medical Physicists, which is going to be delivered by Professor Franco Milano from the University of Florence, Italy. We are pleased to have him as a faculty speaker for this program. He has done his MSc in nuclear physics from the University of Florence and a postgraduate medical physics from the University of Pisa. He is expert in IAEA, VINIA in radiotherapy and diagnostic imaging. He is expert in QUATRO project IAEA. He is a visiting professor in many renowned universities. Like the University of Poland, Bulgaria, the State University, Technical University, Ukraine. He is also visiting in Bangkok, Thailand, VNU, Ho Chi Minh City. He has contributed to many international projects like EC Tempest, EC Leonardo, Emanard, and NATO Science Project. So you can start your presentation, sir. The floor is all yours. Please start and share with us our valuable knowledge.
Yeah. Okay. So thank you, Mrs. Sharma. We can start. This is the first lecture, so probably me and also the participant, we must find the right way to interact. So if you have during my presentation question, you can put the question by chat, and then some organizer will summarize the question to me at the end of the hour, and we will discuss. Anything is new. What I mean that introduction to diagnostic radiology and the role of medical physicists is only a matter to collect data and, thank you. And just to refer to personal experience, because I've been so lucky to visit since 20 years, many foreign university, and on the other side, I guess foreign student in Erasmus program. Sponsored by European Community, and they stay semester in maximum one semester in my university. Then I was a kind of tutor for them. And very good was also the experience made with College of Medical Physicists, where until now there are hundred students from all the world. And believe me, the character of the individual students can be different, because any country has its own culture, and so it is really a pleasure to stay with some audience which represent many countries. Well, if you are dealing with what is the role of the medical physicist, you can read or listen. Medical physicist plays an essential role in modern medicine. Ah, yes. Why? Because we have that since many years. We have some specific technical part, which is at the beginning was not clear if the contribution was from physics or from chemistry or something like this. But anyway, probably the activity of the medical physicist start with the discovery of X-ray. This means in 1895. And some years later, probably 20, 30 years ago, the situation was this one, that you have probably not physicists, but medical doctor taking radiography of this person. As time is passing, we have an increase in the technology. And so if you are dealing simply with radiology, we are moving from very old equipment to old, but not so old equipment, up to modern equipment. And so who is managing imaging and diagnosis needs to have some medical physicist close to who is conducting this activity. In the past, we had that 70% of the medical physicists were dedicated to radiotherapy, 25% to diagnostic radiology, and 5% to nuclear medicine. But what happened now? Now you have that imaging has become quantitative, and you need to have the image contribution in deeply also in radiotherapy. Then we have also some new indication by international body. And in my opinion, we need to have a larger number of people, of medical physicists, taking into account the radiology world. In the radiology world, I am putting also not only ionizing radiation methods, but also methods like NMR, ultrasound, which are using not ionizing radiation. So if we had to follow our role, which is developing year by year, we must try to keep our skill and competences. Now I put some question to you. What is a skill? What is a competency? I found, I went somewhere, I don't remember if it's Wikipedia or something like that, but anyway, the skill can be taught as a specific ability that individuals have. A skill is typically applied in a specific setting in order to accomplish a predefined desired results. Okay, skill can be learned through training or by experience. Perfect. But what is the competency? Competency is a broader concept that combines skill, knowledge, and behavior. So, in my opinion, if you apply a protocol, you are able to have a skill that for that specific task is useful. But if you have competence, you know everything on which the protocol is based. So you know dosimetry, you know how to make measurements, you know how to present results statistically, and so on. So in my opinion, if you are looking the role of the medical physicist increasing, is because our role is linked with competence, not with skill. The skill, some technician in many areas of the world can be skilled to apply a protocol. And you have a lot of protocol in modern activity in medicine. Why? Because we are looking for standardization. And the protocol is just to have the standardization everywhere. So if you are following, for example, the protocol given us for dosimetry in diagnostic radiology, and here you see what are the topics covered by the protocol, you will be able to assess, for example, air kerma in some reference point with the same uncertainty if you are in Rome, if you are in Bombay, if you are in Toronto, or if you are in Melbourne, okay? So this is the goal of the protocol and guideline. But if you are a good medical physicist, you must have competence. This means that what you learn, your cultural background, you can apply. Well, for the protocol is just a basic activity. But anyway, you will be able to face any problem related with dosimetry. So if we agree that now and for the future, medical physicists will have a prominent role in diagnostic radiology, we want that the medical physicist has a prominent role for their competence. This is not easy. Why? Because the radiology and radiological equipment are depending a lot by the economical power of the country. If you go to the United States, you will have hundreds, thousands nuclear resonance equipment. But I'm almost sure that if you go in a not so lucky country, in some area of Asia, probably you have any NMR scanner. So our activity will depend by the economical power and probably also the history of the country. So when we are dealing with which are our competence, probably we had to look the competence that we have in the States and not in the competence you will have in some country in Africa. Why? Because the economical conditions are completely different. When we are mentioning United States, you have to consider that United States have another difference compared with what happened in the other area of the world. If you want to be a professional in the United States, this means to have an activity as medical physicist, you must have an accreditation. And the accreditation in the States is given by the Scientific Society, which is AAPM. And in the States, you have 3 different accreditation, at least. So if you have accreditation in radiology, diagnostic radiology, you have the possibility to work in this field, but you cannot work in nuclear medicine. What you need? You need to have a second accreditation and also the third accreditation. Where is the problem? The problem is that you have to study longer, and also that accreditation is not free. You have to pay yearly to have up-to-date training course, and this means that in the States you have very, very excellent professional medical physicists, but they are active only in one area of activity. This is not true in Europe. This is not true in the other part of the world, but step by step, also in Europe, people is thinking that medical physicists need to have an accreditation. We will see which could be the solution, most of all, the economical solution. For example, I am convinced as a teacher that I must teach everything to any medical physicist. And I forget, because if you are able to manage images and doses for patients in diagnostic radiology, you can bring your experience also in radiotherapy. In radiotherapy, imaging is absolutely needed. And so you had to bring your skill, your competence from diagnostic radiology to radiotherapy. And if you are in a hospital, why you had to have differences between who has competence in diagnostic radiology and the other who has competence in radiotherapy. Probably is a matter to have a education and training and practical which cover both. Of course, this can introduce the difference in time you need to become a medical physicist. Because, for example, in the past, in some country, you become medical physicist having only 1 year master. Then they have changed, they have a 2-year master. Probably this is not sufficient. Please consider that I mentioned what happened in Europe. In Europe, medical physicists must acquire a 4-year course in the university. After that, a 5-year course again in the university. And this second part is split into 2 years theoretical in the university plus 3 years in the hospital. In UK, they are very special. They have introduced the level of clinical medical physicist, and in this case, you need to study 2 more years. This means that you have a long, long time to be trained, because if you consider 4 years for physics, 5 years for medical physics, plus a couple of years for clinical medical physicists, you see, of course, the salary is increasing. But again, if you enter 18 years old in the career, when you end your job, you are more than 30 years old. Anyway, the message that I'm giving to you is that we are looking for competence to keep our prominent role. If you get only skill, you will be similar to a technician. What is medical physics? Medical physics is the application of physics theory, methods, concepts, and principles to medicine and healthcare. Consider that we have in many activity of the medical physicists, we are not related specifically for the hospital, but also with some health structure outside the hospital. The medical physics is the scientific and technical knowledge foundation of radiology, nuclear medicine, radiotherapy, but in radiology, I include also imaging with non-ionizing radiation, and you had to have something specific, which is radioprotection of patients. We will see tomorrow, lecturing about the safety standard given by the IAEA, that which could be why we will have to cover the role of radioprotection of patients, not workers, patients. It's the technical foundation of imaging in other medical disciplines, cardiology, orthopedics, surgery. They don't care a cardiologist want to have a good visual information when he's working, or the orthopedics or the surgery, and they are based on the use of imaging in their discipline. They don't give any referral paper but they want to see. And don't think that this is simple, because think a little bit, and at the end of our talk today, I will mention, if you have virtual augmented reality, What does it mean? This means that the cardiology will follow three-dimensional view within the body of the patient. Do you think that the accuracy of the image could be something which is not deal with a medical physicist? Okay, but we will discuss a little bit later. One point is this one, that the medical physics is focused on measuring performance from a variety of radiation source and system, and calculation dose from imaging and therapy system. Surely, because you have in the new regulation, we have that the dose also in radiological examination must be as low as much as possible compared with the diagnostic quality of the image. And this is very important. So we, medical physics, is focused on the quantitative and qualitative imaging in diagnostic and therapeutic procedure. So if you had to summarize, in radiology, medical physicists must take care of the imaging equipment, imaging procedure, and I mentioned administrative and regulatory aspect because when you face with giving doses to patients, probably you have some obligation, and this is very, very important because in many countries, if the patient receives a dose in a diagnostic examination higher than the dose that can be useful, he goes to the lawyer, and problems with the structure. Okay, just discussing this point, you understand that medical physics is dynamic and is growing constantly, because if you are using up-to-date equipment, surely you are facing something new. I don't remember when I met someone who was say, "Oh, wonderful. I don't know what is contrast phase mammography." Okay, but if you had to make quality control on equipment who is based on contrast phase, you cannot apply the same principle, the same test that you can apply in a simple mammography. And so you have to follow what is happening. And one warning is this one: pay attention, because nowadays is a very reductive to talk about equipment. You have to remember also software. And software means artificial intelligence, and software means deep learning. And we will see tomorrow that in the last basic safety standard is mentioned that we must take into account not only equipment, but also the software which is linked to the equipment. But anyway, we will have the manner to discuss about this point a little bit later. So now you have new equipment, new methods, and dedicated software. But this is medical physics. What about the medical physicist? Clinical service and consultation. In modern approach, it becomes very, very important how you can communicate with the other professional and also the patient. New equipment for case consultation. You must be able to specify the characteristic of the equipment. And when the equipment is bought, you have to perform acceptance test to verify that the specifications are satisfied, and commissioning. Commissioning means that you cannot stop to the specification given by the manufacturer. Before introducing in the clinic, in the diagnostic process, the equipment, you have to make commissioning. If you stop simply to make acceptance test, is not enough. And then periodic test, quality control on the same equipment, but you have to evaluate the general quality control program in general and the dose reference level. Okay, tomorrow we will see in which consists to take into account dose reference level, patient dose evaluation, but we are in radiology. Don't care. You have to take into account patient dose. Quantitative image and quality assessment of the image, yes. Otherwise, any dose become too high, because if you are losing the diagnostic power in the image, so you are giving a not useful dose. Imagine protocol optimization. We will have no occasion, because the topic of these couple of lectures are not related with these things. But anyway, it becomes very important to bring a contribution to protocols. Why? I mentioned only this one. Consider, please, a CT scan. CT scan, the optimization is not fully free. Why? Because you can operate at fixed kilovoltage, 130, 80, no choice. You cannot say, I want to work at a different high voltage apply. You are obliged in this way, if you want to optimize the examination, CT examination, to determine together and driven by the medical doctor and the technician, which could be examination, CT examination by CT examination, which could be the best protocol to reduce the dose to the patient. And this will be very, very important. But probably this could be a matter of individual lecture and not a very general lecture like I'm going to do. Instruction.
Sorry for the disturbance, sir. So we have limited time. Please try to complete your slides timely.
Yeah. So instruction.
And participants, there is a request. You can type your questions in chat box. We will take it later after the lecture of sir.
Yeah, okay. So instruction of the other professional, research and development. Here you have a skill. Probably we have also mentioned this one, and then you will have the presentation and you can read. So you will see which could be the job of the medical physicist. What is required to become a medical physicist? Academic training in the university, clinical training in a hospital, and assessment of the competence. In some states, the professional body administer the whole process. In some other are the government. So how to acquire and to maintain competence? Training, practice, experience, and lifelong learning. Probably the post-COVID scenario will help to follow this optimal path. Webinars, distance learning, and mutual aid between different. So I want to focus the difference between curriculum and syllabus for the medical physicist. And there are some differences. We need both. We need both. I will skip this one. And what is a curriculum? A curriculum is the guideline for the whole academic content covered during a specific course or program. Okay. The curriculum is the predefined combination of the rules, technique through which the academic course's purpose should be realized. What about the syllabus? As a logical continuation of the curriculum is something different. Syllabus describes the whole academic content covered in a particular subject. It may be explained such a curriculum practical implementation plan. And here you see which are the characteristics. I want to look around which kind of indication we can find. Okay, I found this one. This is a core curriculum for medical physicists in radiology. Recommendation from a group, a working group. And this is the list. It was published in a paper. Well, this is simply nothing. Why? Because everybody can give this kind of list. I don't like. You have also this indication, which is a postgraduate medical physics academic program. And here you see all the detail that at that time, please consider that this was issued in 2013, probably published, but probably the experience is a couple of years before. So you see that for knowledge of radiobiology, you have the list of what you need. Medical imaging fundamental, you have the list of what you need to learn. Radiation dosimetry, you have the list. What does it mean? Radiation oncology, I skip out, inverse planning and so on. So, physics of diagnostic and interventional radiology, X-ray production, again, one list for ultrasound, one list of MR. So this must be your guide. Why? And it is a matter of your teacher to select within this program which are the most suitable topic that he can teach to you. Take into account the equipment, the availability of the equipment. So this is what you had to use as a medical physicist. This is the general view, but your teacher will select what is useful for you in your own environment. Additional topic, information and communication technology. We had to increase this one. You see that, for example, you have particle therapy and special technique. So in this case, my opinion is that this program has become a bit old, and we had to increase this part. Here you have an example, and this example is issued by Institute of Physics Engineer in Medicine. They have a different approach. They mention which is the task, and you had to, so they are mentioning the competence you had to cover, but you can look by yourself, okay? If you go here, non-ionizing radiation, you see the task, they are here, that to cover this task, you must have a lot of maintenance. of competence. Probably also this is useful because this is the staffing level in diagnostic and interventional radiology, which has been issued at the level of European community. And so here you see the task, and here you see which percentage of the full time can be given for this task. And this will give you what is doing a medical physicist in Europe. Also, the other list you can see. And I want to mention very, very fast that radiology is changing. In 2008, two international bodies, the agency and the World Health Organization, decide to issue the so-called Bonn call for action. They met, they found an international consensus, and they, in 2008, issue 10 actions they want to be introduced in the radiological practice. And this will increase our competence. I have no time to enter in detail in individual action, but essentially you will have that the patient will be the individual patient. Until now, the patient is a reference patient, 70 kilo and so on. What does it mean? This means that the thin and big and normal patient, we had to receive an appropriate dose. And they introduce also an ethical approach to each patient. And this will bring a lot of new tasks for the medical physicist. I will skip very, very fast this 10 action. You will read because you will receive the brochure issued by the agency and WHO, and so you will see by yourself. I want to go very fast to this one. We have seen that in order to play an important professional role, we must rely on professional education. So an up-to-date curriculum and syllabus is needed to be applied in your education, and this will bring to an upper professional role. What happened now? Well, the situation is that this is not possible for every country, but we have the possibility probably to change something. What we need? We had to take into advantage the opportunity to use the network to operate together also in education. What we need? Availability of the people. Strong coordination between local teacher, which is absolutely essential, and external teacher. Now, if we are talking about dosimetry, I will be an external teacher, but I don't need to have 1 hour. Probably I need to have 10 hours. And I will go deeply. You stay home, and I stay home. And I will bring my knowledge to you. So we need also another great up-to-date syllabus, perhaps a step-by-step path to try to accompany the country with the greatest logistical and economic difficulties to reduce the gap with the more fortunate country. I don't want to mention Nepal. Nobody from Nepal. I respect Nepal. But in Nepal, there are very few medical physicists. How can, and training can be done to them also theoretically, but why not? So we had to bring them. You see here, this is a very, is a map of complexity in science. But this science is coming. Why? Because we have artificial intelligence, deep learning, machine learning, augmented virtual reality, computational modeling, big data, data mining. What is this? This is someone that using augmented virtual reality is building a car. What are you doing? Not you, but what are doing technicians when they put the patient into the LINAC bin? Probably they can use augmented virtual reality. So, and to apply data science, what do you need? You need mathematics, computer science, and domain expertise. If you are a medical physicist, you have this yellow competence, area of competence. Data science need to have your expertise of mathematics and computer science. This means that if you want to keep your up-to-date role in the medical physicist activity, you had to enter in this business. What does it mean? This means that you had to acquire information about data science. As you acquire information in dosimetry, you had to enter. So why? Because in the future, you will use all the possibility in medical care. You will use all the possibility for education, but here is just not so important. And you will use machine learning. Now, today, you are using an Excel datasheet. So, in my opinion, you must have this approach. I discussed with Professor Chugule, with Elsa Bezak, a bit very shortly with Professor Zakaria, and we agree that we can try in the next future for the Asia of Oceania Federation of Organization for Medical Physicists, we will try to write a new syllabi, and we will try to apply what I have described now. So introduce not only a seminar, but to all up-to-date learning, but just to organize basic knowledge for medical physicists, where it's not possible to have university in the country, or at least sufficient university in the country. We will see. Now I stop, and I hope to have some question for you to focus better what can happen. Thank you.
Yeah, thank you so much, sir, for your excellent and informative talk. So let's start with the question answer session. Let's have a look at the question answer. So the first question is from Amir Ali. As the role of medical physicist in the field of diagnostic imaging, but still the hope and importance of diagnostic medical physicist is not accepted or accredited as that of the therapy physicists get. So what could be the possible causes behind these differences? Is it the more involvement of the therapy physicist with patient or something else?
But the problem seems is more related with the accreditation. From which country the participant is coming?
He is from Pakistan.
From Pakistan. Well, I can tell you that what happened in, for example, in Italy, we had accreditation. We have accreditation only now. Pardon?
Sir, no problem. Please continue.
Yeah, yeah. So it's probably the problem to have an accreditation is the last goal you can reach. Why? Because first of all, you must have a well-recognized training and education of the medical physicist. After that, it depends. Or you get accreditation from the National Society. But again, it is absolutely a slow process. It depends how many medical physicists you have in the country. It depends if the government has interest to recognize you. So it doesn't depend only on your own organization. It's absolutely a slow process.
Okay, sir. So our next question is from Muhammad Yasin. What specific tests should be performed in commissioning of CT, X-ray, and mammography?
CT? Sorry?
CT, X-ray, or mammography?
Or radiography?
What specific? Mammography.
Well, mammography. Well,
Yes.
my suggestion is this one, that you know that the manufacturer are obliged to specify the characteristic of the mammographic equipment and also the characteristic of CT scan. I will mention characteristic of CT scan. They can specify which is the accuracy of the Hansfield number. For example, if you have a phantom with water, what you get is a Hansfield number equals 0. But if you go in the reality, you have 0 plus minus a figure. This is a specification of the, together with the noise of the equipment. And then you had to check this one. What does it mean? This means by the use of phantom, and in general, the manufacturer sell to you the equipment and then give to you the phantom, you have to make this kind of measurements. You are not able to measure, like in diagnostic radiology, the accuracy of the kilovoltage, because it is impossible. But again, you had, my suggestion is to give a look to the CTDI, because CTDI, you had to see which is the CTI that is given by a, pay attention, a certain field of view. The phantom is the phantom, if the CTDI is a head CTDI or a body CTDI, you have a plastic phantom of 16 centimeter diameter for head, or 32 centimeter. The 8 is again 16 centimeter, and you make 5 measurements in different points, and you measure the CTDI. So the suggestion is the one, you had to check the specification of the CT scan manufacturer. Noise, CTDI, and probably you can see also, you must be able to calculate MTF and to control the MTF declared by the manufacturer. So the job is What about mammography? Mammography, it depends. If the mammography unit is a traditional one, you can make measurements of kilovoltage. You can make measurement of short-term repetition. You can make measurement of long-term repetition. You can make measurement of spatial resolution. Again, if you have phantom and software, you can make MTF calculation. So in this case, you have a wider range of tests you can have. If you send me your email address, I don't remember if I have put my email address in the first slide. Anyway, it's franco.milano.unifi@gmail.com.
I have sent a slide to the participants.
Yeah, okay. So I can send to you and probably to all the participants an example of test which can be performed in this case. So the answer is that I will give you material. Of course, if you have a tomographic unit, you must do what is permitted by the manufacturer.
Okay, so thank you so much. The next question is from Dominda. Is it possible for a radiographer or biomedical engineer to be a medical physicist?
In principle, yes. My opinion, because, for example, in Europe, but in all the world, medical physicist is a health profession. This is not true for the engineer, because the engineer put the hand on the equipment, not on the patient. And when we are making a radiograph and we are making quality control, we are making something which is related with doses which go to the patient. And this means that to become medical physicist, probably he has some knowledge, but he had to acquire the degree. So he had to attend the master again. For the technician, could be harder because the technician probably don't have specific competence and skill to make measurements. The engineer, surely. But again, in Europe, you must have a master in a training in medical physics, recognized by the government. Then everything can happen.
Yes. So next question is from Khalid Mohammed. Is it mandatory as a medical physicist to learn the working on the machines like radiographers, or just depend on them to help me out when I come to do the dosimetry or quality control?
If you understand well, well, in our legislation, which is simply something related with European directive, technician can work under control and responsibility of the medical physicist, but the medical physicist must draw clearly a protocol. So the responsibility is still to the medical physicist, but when I mention the skill, the technician can have the skill and the protocol to make this kind of test. The same for nuclear magnetic resonance.
So can we take the next question, sir?
Yeah.
Yeah, okay. Next question is from Alex. How to look for PhD opportunities by a diagnostic medical physicist from Asian and European countries? Please give the practical guidance on this, and what are the requirements, eligibility for the same?
No limitation about PhD in diagnostic radiology. The limitations are coming from the wall offer of a PhD position. Why? Because PhD positions are in Europe receive money, and is limited the amount of money that the university can have. So for someone coming from another country, there is a double problem. One problem is the recognition of the legal degree as a medical physicist. So if someone is coming from a country out of a European country, we need to have a recognition. The same vice versa. If I want to go in that country, my degree must be recognized by this country. The other problem is related with the number of PhD, because in PhD you receive a salary, and then the salary is not decided, the amount is decided by the government, but the number of money, the amount of money is decided by the Ministry of Education. And so there are very, very few positions, and it is a pity. My suggestion is this one. If you had to apply for a PhD, sorry to tell that, but you had to apply to an American university. American universities are more open. Please consider that the goal of PhD is to make research. And if you have a good background, probably you have very, very high probability to be accepted in a PhD. My daughter made a PhD. I suggest my daughter to make PhD out of Italy. And she was successful. She went to a university in Amsterdam. She made PhD, absolutely excellent. So my suggestion to you is the same what I made for, but if you are a medical physicist, probably better you make an application for United States. The probability will be very, very high. If you make the same request in Europe, we will see. I don't know about which could be the Germany situation. And I'm asking Golan, what about if you have applicant for a PhD in Germany? It's easy. How many are the possibility?
Yes, this is actually in Germany also not easy. You have DIAAD scholarship. Yes, that scholarship is a governmental scholarship. They offer many PhD positions all around to Germany. So when you go to the embassy of Germany, your country, you see the chart, you can maybe ask the employees in the embassy which country offer which PhD subject. So then you apply in a central position, and when you have good enough or you successfully complete all the conditions, then you will get scholarship. It is a very good scholarship, and you can in 3 years scholarship, and you can also extend. This is actually the normal way. And another way that many German parties, some German, they have political party, they offer also PhD. The SPD, they have political, but not that means that they are working for their parties. They have also good thesis, and you can apply this one. And another thing, you can apply some professor when he has a position and he has money, and it possible. Many professors, they are searching good students. When you have a good students, and you are very hardworking people and very sincere, and you can do that. Sincere, that means also sincere to the philosophy of science. This is very important. I think in Europe, there is enough scope all over Europe. And I suggest the young people, try your best and you will be success. Thank you.
I want to add a comment, otherwise it seems that I suggest to my daughter to apply for a European university. No, yeah. I say, my suggestion was don't look to a PhD position. Look at a PhD position in a very, very important university. And then, for example, she applied one position in, for example, I work in the past with the King's College. She applied with the King's College. She arrived 1-to-1 at the final, then she was not selected. She was going to accept some university in Northern UK. I say, no, but they give me more. No. And finally, she went to University of Amsterdam. After her PhD, she found, of course, believe me, that in our activity, very often we say that it's very important to make research. You make no, it's important not only to make research, but it's important also to have good teacher. Because if you make a research, you make the research very, very selected. But if you are a good teacher, you will have good students. And among these good students, they will get surely good results. So the suggestion to my daughter was go to a good university. Now, for example, my daughter is in charge of University of Cambridge. Okay, I'm happy, and probably she also is happy. So my suggestion is this one: look to the best university and try to enter in a PhD in the best university. So Professor Zakaria told that there are excellent offer. Probably don't look at only at the position, but look the best position.
The another thing is that when you have done PhD in Europe, after finishing your PhD, they give you some money also. When you come back to your country, then you can build up a research project. They give you money. 3 years they provided money. So when you want to build up scientific capabilities in your country, there is a many support. And after that, you can apply ICTP. ICTP, Professor Milano knows it very well. He's one of the teacher there. And ICTP, they give some associate fellowship. When you have ICTP, then you have 3 years. You can go every year for certain period, and you meet the very brilliant professor, and you can have a contact with them, and you can continue your study at home. So it is a possibility when you help your country and you want to be a good scientist. There is enough possibility. This is there. That's why you should actually select what you want. Do you want to stay at Europe, or do you want to go to your country and do that? Even when you want to stay in Europe, why not? You have your roots in your country. You can help people also from there. So it is not a matter of question where are you, but you can build your scientific capability. And Professor Milano tell, a good teacher is important. Yeah, you give just like a chain reaction to the other people. Yeah, that's important. So I suggest my student, when I teach you a very good, I have teach you and I have provided you some scholarship. Maybe I have helped to have this scholarship. Please at least give your knowledge another 5 students. Yeah, please do that, another 5 students. Then we have a chain reaction, and the capability of scientific knowledge in developing country is increasing. Yeah. That is actually important. Even the Europe, they are thinking the migration, the people are coming to Europe. The question is that when we do not build a scientific capacity at your own country, then the migration is always there. who will left his country when there is a possibility there, they can live very well and he can do his research. The people stay, live there. That's why the support is also there, that when you do something also in your own country.
That's so much true, sir.
Yeah. Yeah.
So the next question is from Shahidul Mia. Which protocol are followed for the acceptance test, commissioning, and QA of radiology machine?
Which protocol?
Yeah.
Repeat.
Are followed for acceptance test, commissioning, and QA for radiology machine?
Which radiology? Now the last, which equipment?
Which protocol, sir?
Each protocol.
Only the radiology machine is written.
Yeah. Can I say something?
Yeah, because I haven't.
Yes, because in radiotherapy, they have a definite protocol, yes. TG40, for example, or 186. They want to know which protocol they use for the commissioning and quality control of radio diagnostic machine, maybe X-ray machine or CT also. I think there is a bundle of information in IAEA. When it's German protocol, I can say you very, just quickly, I know this. But in IAEA, go there and you just go to Google and tell radio diagnostic quality control. Then you find maybe many protocols and you can select one of them. There is a possibilities there, yeah. But a standard protocol like TG43 or the TG186 in radiotherapy, I do not know.
Yeah. May I add a comment? In general, the protocols are very similar. So it is not important which protocol. What is important is that you must follow one in diagnostic radiology or in radiotherapy, but anyway, but in general, they are very similar. I remember that I was in the working group creating the Italian radiotherapy protocol, and we were using the same formula, the same data of the other protocol. So it's absolutely, you cannot find big difference. You cannot find big difference. And this is true either in radiodiagnosis and in radiotherapy.
Even you can ask your vendor. You can ask your vendor. Maybe they supply some correct protocol. Yeah, please ask them.
Yeah. Another one?
Yeah, the next question is from Mote Pesto. Are there trainings on data science by SCM PCR?
Data science. Oh, what? The sound is on.
Sir, we are planning in future.
But I haven't, the audio is not the best one anyway. I'm thinking that the future will be good equipment and the data science will be very important. I don't know, but anyway, I propose to write a book and I signed the contract. But anyway, data science applied to medicine, and me and Professor Eva Bezak will be the editor. I believe that data science will become like to use Excel. It's everything. And tomorrow, but I mentioned also today, the basic safety standard include software and equipment. So impossible for us. The modern diagnosis will be made with intelligent workstation. Anytime will be a medical doctor, the final responsible of the diagnosis. But anyway, he will have a big filter from artificial intelligence to reduce false positive, and so this will be the future. And you will make some tests on this one. So it is mandatory. Our competence, otherwise in the future, there was one question about engineer. Otherwise, only informatics will work in the field and in radiotherapy. Because you know that there are treatment planning systems which are simply, you put what you want and the output is optimized. Mackie has realized this kind of, it costs a lot, but anyway, quality control in the future will be not useful. It will be done by the machine itself, by the equipment itself. I have another approach, but I cannot tell you public. But anyway, believe me, in the future, no way to think a little bit to logic. Logic is making tomosynthesis equipment. Okay, everything, they give just one phantom and in 10 minutes you are checking that everything is okay. They don't need to have a medical physicist. And in the future, you will be for each radiological equipment and not only. So, okay, this is because I mentioned if you want to have a role, we must enlarge our competence. We must become problem solving. And when I make the slide with Excel moving to artificial intelligence, if you make something, you are using an Excel file. It makes statistics, it makes everything. Okay, in the future, you have to use artificial intelligence. It's not so difficult. You change, we doesn't know the right statistic. We doesn't know the right, but if you are using Python or R, okay, good, we will learn. If you know, it will be simple for us. Why? Because in physics, we are very clever to make modeling, and we will able to make, knowing the physical law and knowing the equipment, we will be very able to make modeling. And then from modeling to create some software. Oh, it could be easy, but this will be the future. And in the syllabi, I want to mention the tool that we need. Sorry, but probably anyway. I don't like to discuss this in public, but anyway, I, Professor Zaccaria, are in the IOMP Education Training Committee. And at the very beginning, we try to create within our committee a new syllabus. And I discussed, I took some, anyway, we have no success. And then, for example, I asked to Professor Arun, why we don't make this within A4MP? Because the A4MP is the second international society. Number one for number is IOMP. But believe me, the number of medical physicists in your association is very, very high. So probably we, in the next future, we will make our own syllabi, and we will publish, and we will be very happy. Okay, anyway, sorry.
Can we take the next question, sir?
Yeah. But speak in the mic, because otherwise I'm not able to understand.
Hello. Hello.
Yeah.
Are any trainings available for RSO course or certified course, that is radiation safety course?
Why not? Why not? for example, my idea, if someone, but I talked with Anupama, I can give 10 hour, 15 hour lecturing. Of course, it's tedious because there is a time difference, but I can make in the morning for me or in the evening. In April, I wake up at 4:30 in the morning, AM, to be the commission in Chulalongkorn University. It was morning for them, more night for me. Anyway, I can do. I will not die. So,
so what are the basic books?
Textbook.
Yeah, basic books you recommend for AI and data science.
This is, if I understand well, this is a good point because we have a lot of good material by the agency and by AAPM, are not basic, the basic dosimetry and so on, cost a lot. They cost something like $200 each. And so, but anyway, possibly little by little, I can make. One problem is that if I write a book, I need to have some data that I cannot, I have not the copyright, like table of parameter and so. Very often there are graphs that, anyway, we will see in the future. Ask officially, if the participant ask officially to your association to try to make within the association some book to study basic knowledge for medical physicists, we can try. Very informal, not on paper, because remind that there are open access. You can write without any editor, real editor, publisher. Anyway, we see.
The next question is from Zakaria sir. Please explain the main areas of medical physics and radiology.
No. This is for Professor Zakaria.
Yes.
Yeah, he's not listening. No. He's dreaming.
Sir, please unmute yourself. Zakaria, sir, please unmute yourself. We can't hear.
Okay, this is I'm just asking for a student in Europe. Actually, is a CT and interventional radiology. This is the main area where the medical physicist is working. Yes, this is must obligatory. Yeah, because in this case you have more doses associated. So when you work in radio diagnostic department, they actually appoint you as a CT machine and interventional. That's why I just asked. Yeah.
Next question is also from Zakaria sir. Do you think that AI a part of medical physics education master course?
Sir, we are not hearing.
Pronto.
Yes, sir. Please explain. We are hearing now.
So there is one question.
Yes. Gunun Sharma, please repeat the question.
Yeah. So another question from Zakaria sir. Do you think that AI a part of medical physics education master course?
From the agency? No, not probable. Not probable. Because in ICTP is under the master is under the umbrella of ICTP, but the agency has no possibility, in my opinion. They are making courses for trainee. So sometimes they are in specific topic. Someone can apply for this specific topic, and it is supposed that when he's back to his country, he teach to the other. So very, very improbable that we will have such a course. Oh.
Okay, so we are running out of time. So that was the last question.
Yeah. Thank you.
So I would like to end today's session by thanking the chairman of SCPCR, Professor Dr. Ghulam Abu Zakaria, and the entire team of SCMPCR, whose efforts have made this session a success. Thank you all the participants, and we appreciate your presence here.
So,
next lecture is tomorrow, same time, same place.
Okay.
And the topic is IAEA guidance on quality assurance and safety. And I would like to ask the participants to open the video to have a snapshot.
Tum, 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 tum.
Lot of new faces here.
Thank you so much, all of you. Thank you very much for your interaction with our expert and your active participation. We would like to welcome you for tomorrow lecture.
Okay.
Thank you so much. Stay tuned and stay safe.
Thank you so much.
Good night, Franco. Tomorrow.
See you tomorrow. Ciao.
Ciao.
Thank you very much.
Thank you.
Thank you.
Thank you, Gunjan Sharma. Yes, thank you.
Okay.